Knee tendonitis and knee pain is common among athletes and those involved in weight training. Weightlifters and gym goers can experience knee pain during squats, lunges, leg press, and deadlifts. It's something I struggled with for years. It's frustrating, painful, and demoralizing. I fixed my knee pain and I will show you how to do the same. Hello, this is Nuruddin. In this video, I will show you step by step how to get rid of knee tendonitis so you can lift and work out without knee pain. For reference, here is a timestamp of this video. This is a two-part video. In this explainer video, you will learn everything you need to know about knee pain, what causes it, why it happens, and the fastest way to fix it. The second video is a 5 to 10 minute treatment video where I show you step-by-step exercises to treat and get rid of knee tendonitis and knee pain. Before we begin, a quick medical disclaimer. I'm a personal trainer, nutritionist, physique athlete, and wellness coach. I've been lifting for 10 years. I transformed my body, but in the process, I experienced and struggled with several weightlifting injuries, including muscle injury pain and tendonitis pain. I was frustrated and fed up with the generic advice I was receiving from the professionals I consulted with, such as ice and rest it, painkillers, and physical therapy. So I set out to solve this issue for myself. What I discovered worked so well for me, I've synthesized everything I've learned in over 5 years of research on this topic, and that's what I will be sharing with you. So this video is for informational purposes only. It is not medical advice. Knee pain can be a sign of a serious medical condition. It is always a good idea to consult with your doctor to make sure there's no structural damage to the knee. With that said, let's begin. What causes knee tendonitis and knee pain when lifting weights? The root causes of knee pain are chronic inflammation, magnesium deficiency, and muscle restriction. Chronic inflammation. Weight training builds and strengthens muscles, but it also inflames tendons, ligaments, and joints in the body. When the workout target or involve the knee, for example, during squats or lunges, it inflames the knee tendon and joints. Inflammation of the knee tendons causes a burning sensation of pain around the knee. This condition is a type of tendonitis known as quadriceps tendonitis and patellar tendonitis. The burning feeling and pain around the knee are signs of acute inflammation, meaning the pain is temporary. With time, the body heals the knee tendons and the pain goes away. However, when the knee tendons cannot heal and recover and the inflamed tendon pain continues for 3 months or more, it becomes a chronic inflammatory condition. Chronic inflammation is a state where the inflammatory process that enables the body to heal injured muscle, tendon, and ligament is not working, and the body is no longer able to heal on its own. In this case, it leads to chronic knee tendonitis. Left untreated, chronic inflammation in the knee becomes degenerative and leads to irreversible deterioration of the knee joints. Magnesium deficiency. Calcium helps muscles contract. Magnesium helps muscles relax. When the body has excess calcium, which is often the case, muscles cannot relax and remain tense. When a muscle is tense, it pulls and puts tension on the tendons and joints, which inflames the tendons and causes pain. In this case, knee pain. Magnesium also dissolves calcium and prevents the calcification of soft tissues. Calcification occurs when there is excess calcium in the body. Calcification hardens soft tissues like tendons and muscles. In this case, calcification of the quadriceps muscle and tendon leads to quadriceps tendonitis and knee pain. According to the Magnesium Miracle, which is a scientific reference on the health effects of magnesium on the body, heavy exercise, physical activity, and factors such as caffeine, stimulants, diuretics, stress, and dehydration deplete magnesium in athletes. As such, it is crucial for athletes and those involved in weight training to actively replenish magnesium levels in the body. Muscle restriction. When you lift weights and perform exercises that target or involve the knee, the quadriceps muscle contract, become stiff and tight, and after some time lose their elasticity. Muscle restriction occurs when inelastic muscle fibers become shortened and unable to release and lengthen back to their normal relaxed state. In the case of knee pain, lifting a weight too heavy or using bad weightlifting form overstretches the quadriceps muscle and causes them to become restricted. This is usually the trigger that initiates knee pain. When the quadriceps muscle gets restricted, they become shortened and get tighter. Tight quadriceps muscle pull and puts tension on the quadriceps tendon. As a result, it inflames and causes knee pain when lifting weight and during exercise. And in some cases, it also causes instability and a feeling of weakness in the knee. To summarize, the causes of knee pain when lifting or during exercise are: 1. Inflammatory tendon pain caused by strain and inflammation of the quadriceps femoris tendon that attaches to the patellar. 2. Muscle pain caused by stiff, tight, and restricted quadriceps muscle. 3. Magnesium deficiency, which causes muscle pain and tendon pain. Overview. 3 steps to fix knee pain. To fix knee pain, we need to do 3 things. 1. Reduce chronic inflammation to heal inflamed knee tendons. 2. Replenish muscle magnesium levels to decalcify the quadriceps muscle and tendon. This step helps relax tense quadricep muscles, which lessen knee pain. 3. Release restricted quadriceps muscle to improve muscle pliability. This provides instant knee pain relief. It's that simple. If a person does these 3 steps, they can eliminate or significantly reduce knee pain during exercise, whether they've had it for a few months or years. I cover how to reduce chronic inflammation using a plant-based diet and magnesium therapy in the TitaniumPhysique Step 1 and Step 3 videos. So, in the rest of this video, I'll focus on how to release restricted quadriceps and hamstring muscles, types of knee pain, and how to fix knee pain. There are 3 types of knee pain related conditions athletes experience when lifting weights or during exercise. 1. Knee tendonitis, or more specifically, quadriceps tendonitis and patellar tendonitis. 2. Clicking and popping of the kneecap, also known as the patellar. And 3. Instability and a feeling of weakness in the knee joint. I'll briefly discuss all 3. Quadriceps tendonitis is a type of knee tendonitis where pain occurs at the top of the knee joint above the patellar. It's also common to experience pain on the inside or outside part of the knee. To fix and get rid of it, we need to target and release all 4 quad muscles: rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. These 4 thigh muscles combine into one tendon that inserts into the patellar. When these muscles get restricted, they pull on the kneecap and causes knee pain when lifting weights. Releasing these muscles will also get rid of pain on the inside or outside part of the knee. Next is patellar tendonitis. Patellar tendonitis is a type of knee tendonitis where pain occurs just below the kneecap. This pain is caused by strain and inflammation of the patellar ligament. The patellar ligament is a tissue that connects the kneecap to your shin bone. Patellar tendonitis is an extension of quadriceps tendonitis. This means by fixing quadriceps tendonitis, we also fix and get rid of patellar tendonitis. Next is the condition of clicking and popping of the kneecap during exercise. When the quadriceps muscle gets restricted, they pull on the quadriceps tendon and kneecap. This is what causes that clicking and popping sound of the kneecap during exercise. To fix and get rid of it, we need to target and release the quadriceps muscle. Finally, there's the condition of instability and weakness in the knee. This condition is caused by restricted lower leg muscles and the hamstring muscle. The quads are the power muscles of the thigh, and the hamstrings are the stabilizing muscles of the thigh. The hamstrings, along with the lower leg muscles, help stabilize the knee joints. When the hamstrings and lower leg muscles become restricted, it causes instability and a feeling of weakness in the knee. To fix and get rid of it, we need to target and release the hamstrings and lower leg muscles. If this sounds like a lot, don't worry, it's simple. The good thing is you can do it all in the comfort of your home. I've got a video that will show you step by step how to do it. We'll discuss that video in just a moment. The fastest and easiest way to correct restricted muscles and relieve knee pain. In this part of the video, I'd like to discuss the best method to release the collective group of muscles we just discussed. This group of muscles includes the quadriceps, hamstrings, and leg muscles. There are three general options to release these muscles: massage therapy or other forms of manual therapy, vibrating massages, and physical therapy, which includes stretching and mobility. Massage therapy. Massage therapy is effective for treating pain caused by injured muscles and tendons, such as knee pain. However, it's necessary to get multiple massage treatments over an extended time, which can be expensive, making this solution impractical for most people. In addition, most people don't like the intense pain during a therapeutic deep tissue massage. Some people tense up during this type of treatment, which makes it counterproductive. However, the main reason I do not recommend massage therapy or other forms of manual therapy is to fix chronic knee pain as well as counteract and prevent knee pain. It is necessary to treat the thigh muscles often. So unless someone has the resources to see a manual therapist 2 to 3 times a week indefinitely, this solution is not sustainable. Vibrating massages. When you apply vigorous vibration to a chronically tight muscle, it can trigger the muscle to tense up and get tighter. This is because the muscle is inelastic and cannot absorb the shock of the vibration. Most people find that their muscles get tense and tighter after using a vibration massager. For this reason, I don't use a vibrating massager and do not recommend them when treating chronically tight muscles. Physical therapy, stretching, and mobility. Stretching will help lengthen a muscle and it helps reduce muscle pain and joint pain. However, stretching a chronically tight muscle will not lengthen the muscle and alleviate pain. Before you can lengthen the muscle, first, it is necessary to release the restricted muscle. Then you can stretch the muscle to lengthen it and alleviate pain. So physical therapy, including stretching and mobility, are important, but they're not the solution. So what is the best method? Self-myofascial release tools. Self-myofascial release tools, aka SMR tools. The fastest and easiest way to fix knee tendonitis and get rid of knee pain is to use myofascial release tools. Here are 4 reasons why I use and recommend them. 1, they are generally inexpensive, so cost is not an issue. 2, they are effective with trigger point therapy. Trigger points are specific areas in the body where muscles become knotted and cause pain. I will show you how to easily identify those muscles, and because you know and can feel exactly where the pain is in your quads, hamstrings, and lower leg, you can easily target those trigger points yourself. 3, you can use these tools in the comfort of your home as many times as needed. Additionally, these tools are durable and last many years, so it's a sustainable solution. Finally, because you'll be performing the treatments yourself, you can control the pressure. As such, the body remains relaxed throughout the treatment for better and faster results. Here's a quick summary. To fix knee pain, we need to release restricted quadricep muscles. Depending on your situation, if you experience instability and a feeling of weakness in the knee joints, you may also have to release your hamstrings and lower leg muscles. The 3 common treatment options are massage therapy, vibrating massages, and physical therapy, which includes stretching and mobility. However, these options are ineffective or unsustainable. The best method and the fastest way to release restricted quadriceps and hamstring muscles is to use self-myofascial release tools. Knee pain SMR treatment video. I've created a simple to follow SMR treatment video for knee pain. Myofascial release is a safe and effective technique that involves applying gentle, sustained pressure to a restricted muscle or trigger point to eliminate pain and restore motion. The knee SMR video is a 5 to 10 minute treatment routine where I show you step-by-step exercises to treat and fix knee pain. You can use this treatment routine either at the gym or in the comfort of your home. You will need some SMR tools, specifically a rad peanut ball, foam roller, rumble roller, and Physiorite. It's important to use the right tools to get results. If a person uses the wrong tools, the results are going to be frustrating and demoralizing. I've tested a lot of these tools to find the best and most effective ones. So if you don't already have these specific tools, make sure to grab them so you'll have them when you're ready to get started. You can find a link to these tools in the menu section of the members dashboard or the mobile app. Knee pain treatment versus prevention. In this part of the video, I'd like to discuss the difference between treatment versus prevention for knee pain. The treatment routine we'll be using to fix knee pain is the same routine we'll use to prevent knee pain from coming back. The difference between treatment and prevention is how often we apply the routine. For example, to treat chronic knee pain, we need to work on the quadriceps muscle every other day. 1 day treatment and the next day rest to allow the muscles to recover. For faster results, you can work on the quadriceps 2 times a day, once in the morning and once at night. You want to get to the point where the quadriceps muscle don't feel tender during treatment. Muscle tenderness is pain or discomfort when pressure is applied to the affected muscle. Once the tender feeling in the muscle is gone or significantly reduced, you have effectively released the restricted muscle, causing pain. From there, we want to maintain the new level of muscle elasticity to prevent the muscle from getting restricted again. For prevention, use the same routine in the treatment video 2 to 3 times a week to counteract and prevent knee pain. Keep in mind, the more you train and the heavier you lift, the more often you'll have to apply this routine to keep the thigh muscles pliable and healthy. One final point to keep in mind: muscles support and stabilize the joints. When muscles become tight, the joints adapt to the tightness of the muscles to maintain stability. Likewise, when muscles become more pliable and elastic, the joints must readjust to the new elasticity of the muscles. This means when you start applying the routine in the treatment video and the quadriceps, hamstrings, and leg muscles begin to release, the knee joints will need to get used to the increased range of motion in the thigh and legs. During this time, you might feel a slight and temporary discomfort in the knee joint. This is normal and usually lasts 2 to 3 days after treatment. During that readjustment phase, the knee joint is susceptible to instability during movement, which causes that slight discomfort. One way to help the knee joint adapt faster is to perform knee mobility exercises. Mobility exercises improve range of motion, joint stability, and muscle strength by controlling the muscles around the joint. In addition to the knee pain treatment video, I've created a simple to follow knee mobility exercise video in a series called Power Strength Mobility. It's a 5 to 10 minute video. To summarize, you can use the SMR routine in the knee treatment video every other day to treat and fix knee pain. On the days where you're not using the treatment routine, you can use the knee power strength mobility routine to strengthen and stabilize the knee joint for faster recovery. When you get to the prevention phase where your knee feels great and you can lift and exercise without knee pain, use the knee SMR routine 2 to 3 times a week to keep the thigh muscles pliable and healthy going forward. During the prevention phase, you can also use the knee SMR routine the night before your leg or lower body workout, and then perform the mobility routine as part of your pre-workout warm-up. It's also beneficial to use the knee SMR routine after your lower body workouts, ideally 2 to 3 hours after the workout. This practice will help the knees recover faster for the next workout. We've covered a lot of information in this video. If any of this is new, some of it might sound confusing, like it was for me when I first started to learn some of this. If that's the case, I encourage you to go back and listen to this video or the audio program as many times as necessary. That way, you will have the foundational information necessary to fix and counteract knee pain. Once I understood this information and implemented it into my fitness routine, it's allowed me to eliminate and counteract knee pain for the last 4 years. I lift heavier without knee pain, and my knees recover faster after working out. Getting started. To get started, check out the knee pain treatment video in the TitaniumPhysique members dashboard or the mobile app. If you experience instability and a feeling of weakness in the knee joints, be sure to also check out the foot pain explainer video. Thanks, and I'll look forward to seeing you in the next video.